There we go.
Hi.
You're a
Sorry,
busy you're a busy guy.
I'm late to the party.
I know you are the party.
We're still working.
Oh boy. Okay. How many people are you testing a day there?
We saw 70. How many patients did we see? Like 75 today.
Yeah,
And I would say probably 70 of them were testing for antibodies.
got it. I assume people are still coming in with like other stuff. You are an urgent care center, right?
Yeah, so I mean, we saw like cellulitis and broken wrist and gout,
Yeah.
and then some people still with COVID symptoms. So,
Yeah. Well,
still actually testing for COVID.
I think that's a good point. Everyone is now talking about how it's not only leveling off, it's decreasing a bit, but people still don't realize we're at the top of the curve. That's not a great place to be. We're still
Yeah.
seeing more patients now with COVID than we did 2 weeks ago, correct? Three
Yeah.
weeks ago.
Yeah, I mean, we're seeing a decrease in the number of people coming in for COVID testing, but part of that might be there's other options. More places are able to do it.
Yeah.
Also, people are feeling more comfortable understanding that most people's illness is mild and they don't need to get a test.
Yeah.
And there's still a lot of fear of going out and getting exposed if they're not certain.
Of
But
course.
with antibody testing, people really are curious to know if they had an infection, and certainly if you had a positive COVID test,
Yeah.
then coming in, there's zero risk in theory for exposure. So getting that information is really critical to understand if you have presumed immunity.
I gave everybody before you got on board, I gave them the whole B cell immunity, IgM, IgG, IgA. So we went through all that.
Everybody fell asleep.
Everybody fell asleep. I also briefly discussed the confusion right now in terms of describing the tests, because the FDA, I think there's something like 90 different tests that are coming in from countries all over the world. And even though we're having trouble accessing them, the ones that are available, we just don't know the reliability. And that really brings us into the serum antibody test. And where are all the private and public sector people that are going to give us these? So go on.
Yeah, no, I think it's really critical for people to understand that there's a rapid test that's the blood prick. It's like a test that they draw a sample from your finger versus blood draw that's sent to the laboratory as if you were getting your cholesterol or your potassium checked. So we're doing the serum test that's much more sensitive, about 97% sensitivity versus those quick kits, which a lot of them are being manufactured sort of in the black market, and they're highly variable because people running the tests, if you're not skilled or if you don't have the proper technique, you may have a much lower accuracy. So our tests at blood that is being sent to the lab have the sensitivity of 97%, versus the quick tests for antibodies are running about 84% under optimal conditions. So
optimal. Yeah. And you have to consider the clinical picture, right? Yes. I keep telling everybody they think there's going to be this like magic bullet test. And even with the best of tests, and this is true of any disease in medicine, these are just pieces in a puzzle, but we need those pieces to get back to life, right?
Sure. And having a negative antibody test may not really help if the timing isn't correct. So if you were ill, but it's only been 2 weeks that you're getting an antibody test, you might be testing too soon. Yeah. So there's that understanding of the timeline and what that looks like. And certainly these people that are doing these antibody tests that are at home and they're not being supervised by a physician or a medical professional, that's really where I think you're going to get into trouble. So there's a lot of concern about using this information and the inappropriate use of this information. But I think the positive part of the story is it's more information. We didn't have this as an option a week ago. And now all of a sudden we're able to tell if people have some immunity. So I think that that's the real message, not trying to poke holes at why this isn't good information.
Absolutely. The New York Times, I think, was it today or yesterday, did a big piece trying to poke holes in all these tests and so forth and so on. And I'm like, okay, I definitely, all these unknown non-FDA regulated tests we'd have to use warily. But at this point, a week is a very long time in the world right now.
Yeah.
To us. You know what I'm saying?
It feels like forever, but this all sort of unfolded 8 weeks ago.
Yeah.
So a week is not that big of
right. It just feels like that. Now, why do you think? Obviously, you have a lab that you feel is very reliable and you're working with. Why do you think there aren't 30 labs in the New York area that are doing the same thing?
Well, there are. I know for a fact that BioReference is trying to get the same test that we're using with my lab, Lenko Lab, but they just haven't gotten the equipment and they're not up and running as fast. Part of the problem is because they're a huge corporation that's multi-state. The lab that I'm working with is small. It's only a New York-based lab. And similarly, we're a small practice that is nimble and able to adapt. So, I started to speak with the lab director. I heard that they had availability, and that was really where we put our focus next, just like we did for COVID testing. So it's all about being nimble and flexible. I mean, hospitals are not very fast-moving entities.
No, and they're thinking about critical care people right now. They're doing what they need to be doing.
Absolutely.
No, it's actually it's smaller healthcare providers like yourself and me, and that they're just thinking about this, because if somebody doesn't do it, who's going to do it? You could hear about like Blackstone donating $10 million to the effort, but someone actually has to implement and start getting the ball rolling here.
Yeah. That's what's pretty cool about doing what we're doing right now. I mean, it's literally making a change on the most important level. And, sort of seeing what that information looks like. I mean, I don't think that there's been a more interesting time in my professional career to be part of a process and making a difference. Yeah,
so you and I talked about finding a way to expand what you're doing, and I certainly want to get involved and do anything we can and maybe bring it out to Suffolk County. I know we have a lot to discuss about that. Do you think that, do you think in like a week, in 2 weeks, there'll be like 100 of people like you and me trying to do this?
I would hope so, because then we're really starting to show that we're doing massive testing and getting real information. But I can't make that prediction. I mean, I still don't see wide scale testing for COVID testing. If you ask most people, they don't know where they can get a test. And still, despite what's being recommended to testing everybody, people are going to different healthcare providers and they're being told you don't qualify for a test. That's not what we're being directed from, the governor. And there's so many asymptomatic people who are carrying it. So I don't know what to predict at this point. I'm not making a decision.
I had a lot of friends in Florida and California that even a week ago were having unknown. They didn't even know if it was nurses coming to the house or people were coming to their home, charging them a couple $100 for antibody testing.
Right.
So some were blood draws, some were not, some were nasal swabs. A lot of people don't actually know what they're getting when they're getting tested. What you say the word, did you have a serum test? And they don't know the difference between a swab, a saliva, or anything. And unfortunately, I'm sure there's an enormous amount of fraud out there. What do you think? Are you doing antibody and molecular testing on everybody? Like, how are you deciding?
No, we're just we're doing basically. I mean, if somebody's got an acute illness, we're running the traditional PCR.
Yeah.
But somebody has had it, they think they've had it, or they just want to know because they had presumptive exposure. We're testing them. So it's just the serum testing.
There are so many people, I know I was one of them, that was like 5 days, no fever, past my illness, and like, how do I know when to get the hell out of here? You know what I mean? As a physician, 72 hours and like no symptoms for a couple weeks, that's enough. But that may not be enough for that. It may be different for everybody.
But here's an interesting point. The hospitals are saying you could go back to work if you've had symptoms for more than a week and fever for 3 days. Why? Because you're presumed now immune. You've recovered. I mean, of course, we're still using PPE in the setting, but they're understanding and using the general principles of immunology to go back to work. But now we have a test that says, wow, you actually are testing positive for antibodies, and everybody wants to say, well, that's not really helpful information, or we shouldn't be relying on that. I mean, it's just the two are not congruent.
You have to put the two together. And again, we're finding out more and more. Who knows of this study in Korea? There may be people that carry the virus a lot longer, or it reactivates. So I think the antibody is so important. If you had to make a checklist, because we know in a perfect world we can't test everyone that walks in the door. If you who is the person who walks in the door that you're like, I need to do an antibody test on?
I mean, I honestly think it's anybody that thinks they need it.
Just not actively sick, right?
Well, I mean, you could do the antibody test on actively ill people because it tests for IgM antibodies.
That's right.
So we have a controlled environment. So I'm not worried about people who are sick coming in because we've already established protocols to reduce the flow of patients. One patient in, one patient out. You go right to a private room. The rooms are being desanitized between every patient with bleach. So for us, that's not a concern. But the ideal patient to test is anybody that thinks that they need it, because there's so many people that have been asymptomatic that are going to end up having antibodies and not even know that they had an illness.
How expensive are these tests? Are they a lot more expensive than the finger prick?
So our lab test for self-pay is $50, and that's for both IgM and IgG.
I think that's like very reasonable. Most people could do that. I mean, without naming names, I've heard of like concierge doctors that are charging hundreds of dollars for that finger prick test without any reliable source. And I know for myself, those end up could be like $25, $30.
Yeah. Yeah. I mean, everybody's going to definitely gouge a little bit when, they're providing private services, but
doctors shouldn't be.
We're a walk-in clinic, I'm sure you've never marked up any of your services before.
Only the doctors, only doctor peers.
But, we're a walk-in clinic. We see patients. It doesn't matter, what socioeconomic level you are. We take most insurances. It's just the lab that we're using is not in network with every insurance. So if they're not in network, we're charging people the self-pay price because we don't want you to get billed as an out-of-network lab. That can be much more expensive. So that's really the issue now. As other labs come in to provide the service, then we'll have more options to send for our patients. Yeah. But the reality is there's really nobody else that's doing this testing in New York. So it's a weird time.
Except for you. That's amazing. Cure Urgent Care, Upper West Side, Upper East Side. That's where I went as a normal patient.
Yeah, I'll put it here, and you can pin it. Do you know how to pin?
Oh, God. I could barely close the button on my pants. You want me to pin something? How do we do this?
So I wrote it there. I might be able to pin it.
Let's see.
I think you have to pin it because you initiate. If you hold on it, if you just press on it and hold it, then
I'm holding
you to pin it.
Oh, there we go. Pin comment. Look at that. Boom.
Yeah. Okay. So then if anybody wanted to, find out more information, you could go to the website. We're going to start free registration so people can get their paperwork completed before coming in, which will expedite the process even faster. But, most of our patients didn't wait more than 15, 20 minutes. So we're really getting efficient at this, which is much easier.
Do you take walk-ins as well, or is it just by appointment?
No appointment, because we're, walk-in urgent care, but we're going to be able to get people registered in advance. So at least you could skip the step of, getting your insurance verified and filling out the paperwork.
Yeah. Well, again, we talked about hopefully being able to expand the service. Do you think, is your lab, like, are they growing and trying to expand their service as well? Will they be able to handle the volume?
Yeah, I mean, they've been able to commit to 1,000 tests per day, and they think that they're going to be up to 2,000 in the next week. Yeah. So that's a lot of tests.
Yeah, I mean, just my general assumption and opinion is that a local active molecular lab is going to have greater legitimacy than some like unknown Chinese or South Korean test that looks like a little toy of some sort. So
and who knows if it was properly stored, because those things can be affected by elements like a heat. So we want to make sure that they're not being compromised because of the condition in which they were shipped in or delivered in. So many factors with those. But any information is better than no information.
Absolutely. We'll take it all. And again, I think the main thing before we finish this, no matter what test you have, it does not give you a passport to not practice the mandated rules, correct?
Yeah, exactly.
People keep forgetting that. People keep forgetting that. You and I are both immune. We have negative tests. We have antibodies. I'm not going to the grocery store like shaking hands and giving out hugs. You know what I mean? We really still have to do that. This is about providing information so that hopefully we can stage getting back to life also. And I look forward to, we're going to be speaking a lot, you and me. So for all of our audience out there, we're really trying to work with Suffolk County political people there to see if we could expand this service.
Yeah, that'd be cool.
I think that's going to be amazing, Jake. And maybe I'll get to meet your dogs.
Maybe.
Okay. All right, guys, get back to work.
All right.
Okay, see you later.
Bye. Talk to you later.
Bye.